All right, so for this video, we're going to talk about communication in public health. And so we're going to just go ahead and dive on in. So what is health? Well, I can't really prompt this to you since it's a video, but how do you define health? From previous semesters, what I have found when I have had people fill out a what is health, just little questionnaire, a lot of the students stated that it's a state of total well-being, physical and or mental, and being free of illness. Those are the main definitions that students used. And those kind of pick up on both of the medical models, so the biomedical and the biopsychosocial models of health, right? A state of total well-being, so both physical and mental healthiness, as well as being free of illness. So your body is physically free of illness. So, like I said, on the next slide, it's that same definition, a state of complete physical, mental, social well-being, not merely the absence of disease or infirmity, right? So we're not just not sick to be healthy. We might not be sick, but mentally we might be struggling. So, former students had stated that their top health issues were obesity, nicotine addiction, smoking, tobacco use, the opioid use, the epidemic, addiction in general, mental health, and costs of healthcare. There's a distrust in medicine, cancers, barriers to information transfer. So these are all health issues that you saw, or I say you, but they were former students, but that former students saw as big issues within their lives and their health. And I would think that you would agree with a lot of these, especially being in college, being in West Virginia. These would be things that come up for you. So let's talk about health issues in the state of West Virginia. West Virginia is the second highest state with adults ranking fair or poor health status. They have the highest obesity rate in the U.S. 9.3% of adults have no health care coverage. The average nationally is 14.1. It is the third highest rate of cancer prevalence in the U.S., so similar cancer screening rates to the national average, meaning maybe they're not getting screened here. It is the second highest prevalence of diabetes, and the second highest smoking rate, second highest smokeless tobacco use rate, and similar e-cigarette rate to the U.S. So West Virginia has a lot of health issues that we don't necessarily focus on, okay? So let's take it out. What is health communication? And there's a couple different definitions. So Parrott in 2005 says, health communication is the study of discourse about being well and well-being, right? So we're studying how to live better, how to be well, how to increase our well-being, right? That's Parrott's definition. Clifton Frymouth in 1995 stated that health communication is like education. It is an approach which attempts to change a set of behaviors in a large-scale target audience regarding specific problem in a predefined period of time, right? So we know that right now, if we were using the Clifton Frymouth 1995 definition, we would, maybe a behavior is the opioid epidemic, opioid usage. So we attempt to change that behavior to having access to opioids, to using those opioids in a large-scale target audience. So our audience might be citizens in the state of West Virginia. And the specific problem is this opioid epidemic, and maybe when you want to do this for 5 years. We set out to do this for 5 years, right? And then hopefully at the end of 5 years, it's better. So that's Clifton Frymouth in 1995. So Healthy People 2020 and the CDC states that it encompasses the study and use of communication strategies to inform and influence individual and community decisions that enhance health. So for this, we're taking communication strategies that are going to not only inform the general public, but influence them at either an individual level or a community level to enhance their health. Right? So we're working to enhance people's health. Our book, which uses Krebs and Thornton 1992 definition, states that it's the way we seek, process, and share health information. So that encompasses everything from changing behaviors to talking about it, to finding, to being examined, right? So it's the way we seek, process, and share health information. Now, Klein also has a pretty good health comm theory. So it's an area of theory and research and practice that's related to understanding the influencing and interdependence of communication, so symbolic interaction and in the form of messages and meanings, and health-related beliefs, behaviors, and outcomes. I'm sorry, I don't know why I'm so yawny today. So it's not just doing health communication well. What does it look like for better or for worse? How does it affect outcomes? Why is it happening that way? So taking a look at everything surrounding health comm from a research perspective. Okay, so let's talk about the scope of health communication. Health comm is not everything. It is centered on messages and meanings that are fundamentally social. It includes both formal and informal communication contexts, addresses both intended and unintended messages, and takes social systems and a transactional approach. So basic unit of analysis is the transaction. Sorry. So where do we get our health information? Where do we get information that affects how we think about health? Is it just from our doctor? Is it from family discussions? Is it from PSAs? Is it a combination of any of the aforementioned? So with health communication, we try to adopt an ecological model of health communication. So this takes place in a web of different social contexts. We've got interpersonal, so verbal, nonverbal, intrapersonal. So communication one-to-one, intrapersonal means communication within oneself, right? We take an organizational approach, so the physical space, the management, the team structures, those are all important for health comm. Media, there are images that shape and influence, our health beliefs. Cultural, what does health mean based on our culture? How do we view illness? How do we view it in the United States? And then legal and political. So regulations, access to care, care affordability. And knowing all of these in the ecological model, we can understand health communication more. So individual choices are just a piece to the puzzle, and the choices we make exist in the context of a complicated web of social and structural forces, right? So our choices influence us, they influence our situation, they influence our health, but it can also influence those around us, and those around us can influence us based on these different contexts. Okay? Connection to public health. So public health, the approach to medicine that is concerned with the health of the community as a whole, and the mission is to fulfill society's interest in assuring conditions to which people can be healthy, right? So we're trying to make people healthy, make the community healthy. There are stages of disease control. So prevention, we prevent the disease before it happens. Detection and diagnosis, so we detect the disease and we can diagnose it. So yes, you have cancer. Yes, you have anxiety. We can treat it. So with treatment, do you need medication? Do you need a cast? Do you need radiation, chemotherapy? We have survivorship and support. So you survived this illness and now you have the support you need to make it through the rest of your life. And then there's end of life. So you didn't survive the treatment or the diagnosis, and what do we do for end of life care? So there are 3 core functions. The first is assessment and monitoring of the health of communities, populations at risk to identify health problems and priorities. So this is where identifying and diagnosing a disease or illness requires communication with patients, providers, etc. And communication and social factors might influence how readily identifiable problems are. Second is the formulation of public policies designed to solve identified local and national health problems and priorities. So what policies are in place to counteract this? What do we need to update, revise? What do we need to do to solve local and national health problems? And the third is to ensure that all populations have access to appropriate cost-effective care, and that includes health promotion and disease prevention services, evaluation of the effectiveness of that care, right? So a couple years ago, people who didn't have health insurance could have Obamacare. It was the Affordable Care Act, and it was still pretty pricey. So basically what this one is saying, that everybody in the population should have access to cost-effective care. All right, so we've got some vocabulary. There is disease versus illness. This is a big one. So it's pathology. You've heard of things going down to pathology to be examined. So the disease is the actual disease. The illness is the experience with it, right? So I suffer from anxiety. My experience with anxiety, when I'm very anxious, I get very irritable. I can't calm down. I can have panic attacks, right? So it's pathology. So anxiety is the disease. The illness is my experience. How do I experience anxiety? Health disparities. So these are preventable differences in burden of disease, injury, violence, or opportunities to achieve optimal health experience by disadvantaged populations, right? So these are preventable differences in burden of disease, right? Based on your socioeconomic status, based on your job, you might have access to really good healthcare where somebody who works really hard at life might not. And that's important to note because these are preventable. So let's talk about prevalence versus incidence. Prevalence is how widespread a disease or condition is currently, and incidence is how fast a disease or condition is appearing, right? So let's use the coronavirus. How widespread was this virus at the beginning of the pandemic, right? It's pretty widespread. And then it finally came to the US. So it wasn't so widespread that it was here in a day, but it got here pretty quickly. And then incidence, how fast the disease is appearing. Once it was here, how quickly did we see cases start popping up? Very quickly. Okay, so prevalence versus incidence. The models of healthcare, the biomedical, biopsychosocial, and sociocultural. We talked about those, so I'm just going to kind of glance through these first two. So biomedical, pathophysiology of disease. It's evidence-based scientific inquiry, right? Care is identifying symptoms and isolating biological components of a disease to be diagnosed and treated. Focus is the disease. Biopsychosocial, it combines biology, psychology, and social expectations. We pay special attention to how disease or illness is influenced by psychological and social forces. So the focus is the illness and the disease. And then finally, The sociocultural. So this health reflects complex system of personal choice, social dynamics, and culture. It's all intertwined together. Personal choice, social dynamics, and culture, right? You can't have one without the other. Health is personal and a product of one's environment. And choice and environment are interrelated, right? So if you grew up in a house that was full of smokers, your parents smoked, that might influence you to smoke because it's what's always been done. So I might as well just do it too. It opens up new venues to study health. So food deserts where there's nothing for miles and miles and miles. So the only food you get is from the one gas station that's 5 miles from your house. Disease from environmental contamination, cultural barriers to treatment, barriers to accessing health resources, no transportation, no insurance, whatever it might be. And it's usually included with biopsychosocial approaches. All right, so recall the ecological approach to health comm. Health-related behaviors and outcomes are based on individual choices, intrapersonal forces, interpersonal interactions, organizational constraints, media images, cultural background, legal and political context, right? So our health-related behaviors and outcomes are dependent on those. So the purpose of communication in health is to create a receptive and favorable environment, whereas health information can be shared, understood, absorbed, and discussed by the intended audience. And then finally, studying health communication is the communication in a context promoting health and facilitating information that we use. How can we adjust this communication variable to make it better? And we need to keep patient and outcome first approaches. And that is all I have for communication and public health. So I'll see you in the next video.